Hello, everyone. I'm Barbara Hamm Lee. Well, the best laid plans sometimes go awry. On this edition of Another View on Health, we were supposed to talk about women being sexy healthy. Unfortunately, our guest, urogynecologist Dr. Terry Ann Samuels, has come down with a bug and has no voice. But no worries, my co-host, Dr. Keith Newby, is here, and we're opening the phone lines for your health questions, including your thoughts on what's happening in Washington with the Affordable Care Act. Call in to 440-2665 with your health questions. Another View on Health with co-host, cardiologist Dr. Keith Newby is next, so stay tuned.
Discussing today's topics from an African American perspective, this is Another View.
Hi, everybody, and welcome to Another View. I'm Barbara Hamm Lee. Today, it's Another View on Health, and we were supposed to focus on women and questions you may have concerning sexual and reproductive health. However, our guest, Dr. Terry Ann Samuels, has come down with a bug, and she has absolutely no voice, and so she couldn't talk to us over the phone from Houston, Texas, so we had to regroup. But you know what? We were not even worried about it because my co-host, Dr. Keith Newby, is here.
There you go.
And we're going to open the phone lines and let our audience talk to us today. How about that?
We're going to have some fun today.
Absolutely. 440-2665 or 1-800-940-2240 are the numbers to call. Give us a call. We also want to talk a little bit about what's going on in Washington with the Affordable Care Act and how things are going in terms of being able to pass this bill or not.
Right. Exactly.
From the Republicans. And last night, Keith, around midnight or so,
I tell you,
Mr. McCain
John McCain's my man.
He kind of jumped out there,
He
didn't
is my hero, and I tell you why. Not so much so because I will say that I'm the Affordable Care Act, as we know, there's people for, there's people against, and we know that the bill had issues going into it. And I remember during that time when President Obama, when it was introduced and had to go through the House and then the Senate, and there were issues there, and they couldn't come to a conclusion about like the government option, which they were trying to do, amongst other things. So the form they went through was not what President Obama envisioned, but it was what got through. We knew it had problems, but the issue has been figuring out how to deal with those problems, and that's where we've fallen short. And then here come the Republican with their particular repeal and replace. And if you look at what they said that was going to do, and that's where I'm trying to make sure people understand that the bill that they were talking about putting in was going to take away the mandate, and
the mandate that people
had to have insurance,
right? Which means that more than likely, if you were healthy,
yes,
you probably would not
exactly.
buy the insurance.
Which is why they said the second part of that is your premium would probably go up 20%, and all these people would start losing health care. People have to understand how that insurance game is played. I don't agree with it. I don't necessarily like it, but the realities are that the healthy people help pay for the sick people. Because otherwise, nobody could ever afford it because everybody be paying $1 million a month, and that's not going to work. But seeing the fact that, what I like, and whether or not I vote Democrat or Republican is irrelevant to the issue of what's right and what's wrong, and that's why I had such respect for John McCain, because he said what he felt was the right thing, which I agree with him 100%.
Okay, well, let's take a listen to what he said a day or so ago, yes, as he came back to the chamber in order to place his vote.
Yeah.
We're getting nothing done, my friends. We're getting nothing done. And all we've really done this year is confirm Neil Gorsuch to the Supreme Court. Our health care insurance system is a mess. We all know it, those who support Obamacare and those who oppose it. Something has to be done. We Republicans have looked for a way to end it and replace it with something else without paying a terrible political price. We haven't found it yet, and I'm not sure we will. All we've managed to do is make more popular a policy that wasn't very popular when we started trying to get rid of it. I voted for the motion to proceed to allow debate to continue and amendments to be offered. I will not vote for this bill as it is today. It's a shell of a bill right now. We all know that. I have changes urged by my state's governor that will have to be included to earn my support for final passage of any bill. I know many of you will have to see the bill change substantially for you to support it. We've tried to do this by coming up with a proposal behind closed doors in consultation with the administration, then springing it on skeptical members, trying to convince them that it's better than nothing. That it's better than nothing? Asking us to swallow our doubts and force it past a unified opposition. I don't think that's going to work in the end, and probably shouldn't.
So he was very specific in terms of saying, I'm going to vote my conscience.
Yes.
I'm going to vote the right way in terms of what was presented.
And I applaud that.
And then last night, he voted against the final bill that they had put forth.
Which he should have. I mean, really think about what the issue is with health insurance and what's going on with the mandate. And I'm not sure I totally understand why that is an issue, why people feel like they should have, they talk about this right to have and not have insurance. Can you go buy a car and just say I can get my registration and all that? You have to pay
you have to have car insurance.
Uninsured motorist fee, which is the same thing if you have a car and you don't have auto insurance. You have to pay an uninsured motorist fee. I remember that when I was 16 getting my license. It was then. It's still the case now. There's no difference. The thing is, people have to understand, if you go to the hospital and you don't have health insurance, who's paying for your care? That means that I'm paying for it, because that means I'm going to sit there with you for 12 hours and I'm not going to see a thin dime for it, and I'm giving you all my time, efforts, and expertise. The hospital is you're giving resources. They're not going to get anything for it.
And doctors are mandated or not to actually provide care.
We took an oath when we had our medical degrees to take care of patients, to first do no harm, and to provide a service. Now, I'm not saying that we should get paid some ridiculous amount of money, but our time and efforts are going in. If you're going to ask me to work for free, then you should work for free, which means that when you do your job and you go to work, if the company that you work for is short a month and they don't have enough money, you should suck it up and deal with it, because, heck, if you're asking me to work for free, then you should be able to work for free. I mean, it's not fair to anybody, but the bottom line is that the people are in that mandate. They're not going to get insurance. Characteristically, it's going to be a healthy group of young people, which helps to pay for the people who are ill and can't afford it, because otherwise you would not be able to afford the insurance
at all.
So there has to be a balance between the two.
So since the Affordable Care Act came into being, did you notice, or have you noticed, an increase in patients and people who previously did not come for health care?
Yeah.
I mean, what's been the change from a doctor's perspective?
Well, I'll tell you what the issue is. What we see. We see more people with health insurance, but we also see a lot of people that say they can't afford it, because what happened was, in the original design, the federal government was supposed to be help subsidizing the states, for that. But a lot of governors didn't want to accept it.
Because Virginia was one that did not take
did not want
the
to
Medicaid.
take. Exactly. So hence, that took away some of the help that these patients would have had they took that money. So, of course, then you have these insurance prices going up. And the reason insurance prices are going up is not because of, Affordable Care Act. It is in part, but it isn't. The problem that we're running into is you have this, and it's not a big group of people, but it's a significant group of people who, unfortunately are very, very sick. Once you said you can't, turn anybody down for pre-existing conditions, which I'm not saying you should. It's just, unfortunately, so a lot of these patients, and I deal with it all the time. They come to the hospital, you give them a set of instructions, you get them better, and you say, okay, I need you to do this for me. I need you to go out, I need you to take your medicine, I need you to lose weight, I need you to stay active, and they go out and don't do any of that. Hence, they come right back the next week or several weeks later with the same problem, sometimes worse, because they didn't follow any instructions before. And all of a sudden, the costs start rising because you have, the hospitals are putting in their charges for this patient who doesn't do anything you ask them to do. And all of a sudden, this insurance company has to pay all this out. So then they go pass the cost on to the consumer. So all of us have to pay the price for those groups of people who don't follow instructions. And I'm not saying that's everybody, but it's a large group that don't. There's like they're diabetic, they don't understand, the issues of how to take care of their blood sugar. They don't understand what they're eating is getting them in trouble. But it's a multitude of problems because those same patients, unfortunately, so they live in a food desert, that they don't have access to decent food, or if they have good food or have access to it, it costs 3 times what something a lot cheaper and worse for them are. So it's a whole conglomerate of system problems that unfortunately so we're made victim of. And you know, I understand where, you know, Senator McCain was coming from. He says, listen, guys, we have to come up with a better plan. And the reason partly I know all this is because I have friends who are CEOs and vice presidents in some of these insurance companies, and they've conveyed to me what their issue is with the Affordable Care Act. It's not the act itself. It's the other stuff, like the fact that they have to, you know, pay this extra money for these group of people.
Okay, so last night the vote was for if I'm not mistaken, it was the final of the 3 options that the Republicans had on the table. It failed 51 to 49.
Yes.
So 3 Republicans, 2 women, and Senator McCain voted against it. Our president said it's the Democrats and 3 Republicans' fault. Yeah. They've let down the American people. Where do you think it's going to go from here?
I think my hope is that they follow Senator McCain's advice, which is that they come back together and say, okay, what are the problems with the Affordable Care Act and how we can make it better? I mean, to be honest with you, the repeal and replace issue, I don't understand what the point of that was anyway. Why not just, I mean, if you know, I mean, we know underlying
why repeal
all
the
this.
whole thing?
We know underneath
unless you
all
have
this.
a better plan.
I mean, realistically, come on, that's all politics. I mean, they didn't like the fact that President Obama was the one to put this through. I mean, they've been on this ever since it started. I mean, I'm a realist. I mean, I consider myself more independent than anything else. If I see a Republican that's running for something, I can tell you, if John McCain came here and ran for something, I'd vote for him. Not because I believe in all his policies, but at least I know where he stands, that he sticks to his word of what he's trying to do. I wish the other Republicans, they're just scared. I mean, they're scared to go against the establishment.
The whole idea of what's going to happen in terms of the voting booth sometimes overrules what happens in terms of the bill.
But the bottom line is they're going to have to make a stand, and unfortunately so. Sometimes the American people, they don't even know what they really want. I mean, because they don't understand this stuff. All they know is what they're told. But we hope that our elected officials will get in there and really say, okay, we understand this dynamic and we understand what needs to take place.
You know, and when you bring that up, another good point. For example, Congressman Bobby Scott, as an example, has been spending a lot of time meeting with the community to explain things. But community members need to show up.
Yes.
Also, because, you know, I've been doing some other work with various groups where communities need to come together in order to make a change. And, excuse me, pardon me, when you have 20 people show up, you know, not everybody's getting the word.
Well, the unfortunate reality is a lot of times we as the American population, we know how to complain. Oh, we can complain with the best of them. But when it comes down to saying the action that needs to take place, which is that we come together and say, okay, how can we as a community? Because when you really think about it, you know, Republicans and Democrats, I mean, they play to their base. And if their base is a select few people that they're the most vocal, that's who they're going to really go to instead of it being to, you know, everybody.
I am so sorry. Got something caught.
I guess I don't know. I guess Barbara's having some problems today. She might lose her voice too.
I'm about to lose my voice too. Let's talk to Mark in Norfolk. Hi, Mark. You're on the air.
Hey, good afternoon, and thank you for your expertise, Dr. Newby.
Not a problem.
Hey, look, I just want to say, I know you mentioned that you just a second ago that you knew some CEOs of healthcare organizations, but I think one of the biggest climates, the biggest problem right now is profit has just been totally redefined.
Yes.
And so, therefore, the issue, I think, is greed.
Oh, that's always the issue, man.
Right.
Well, you know, interestingly, though, to your point, though, you know, one of the provisions of the Affordable Care Act was that if you know they profiteered too much, they had to give some of that back.
Yeah.
You remember? But let me say this though: if you talk about, you know, if you making $20 billion. I mean, you know, you talk about losing a percentage of $20 billion. I mean, in the grand scheme of things, that's not, you know, I mean, that's nothing for them to get that back. I mean, in the grand scheme of things, but you're right, though. I think that plays a big factor. And you know, that's a lot of it because I remember, you know, in 2008, and you'll appreciate this. I get in trouble for saying this, but I love getting in trouble anyway. In 2008, when the economy crashed, and I remember, the banks got all that money and they were paying their CEOs all this bonus money.
Right?
They spent one day, and I'll never forget this article, I wish I kept it, but they spent one article I read about the insurance companies, and it showed how strong their lobby group is. I heard nothing about it since, but they were talking about what their CEOs made and their bonus checks. Anthem's CEO in 2008 got a $32 million bonus. One dude for Anthem in 2008 during the financial crisis. One guy. You're not talking about the other VPs, shareholders, any of that stuff. I think Aetna's CEO made like $21 million bonus, and I think United Healthcare was like $23 million. Everybody was 18 and higher. One person made that kind of money. So that tells you right there, what the bonus structure is and how much these people are really making. Yeah. And that's why I tell people all the time, don't, unfortunately, so like if I order a test and it gets turned down, or I order a med and it gets, it costs a lot of money, and the patients are fussing at me saying, you're making me spend all this money. And I'm like, wait a minute, I'm not making you spend. I'm trying to give you the best for you. You need to talk to your insurance carrier and ask them why they're turning this test down, or why they're charging you so much money for this drug, instead of talking to me. But the insurance carriers get a pass. You really think about it.
So can you go back to your insurance carrier and question those things?
Yeah, you should. Okay. Because you're the one paying them. If you're actually paying the money that's supplying these people the capital they need to do things, you should be able to call them up and say, listen, I have a concern about this, and I'm paying you guys a fair amount of money a month, and you're telling me I can't have this test. Unfortunately, but that can't be like just one person. It has to be a network of people who always come together, who say, listen, because it's like you mentioned earlier about people not participating. If you have, if you have 100 people and only one ever says anything out of 100, they're not going to pay you much mind, versus if you have 90 of those 100 people saying something, then all of a sudden they're going to start listening. Absolutely. And that's what's not happening.
Absolutely. 440-2665 or 1-800-940-2240 are the numbers to call. We're talking about health in general. We're talking about the Affordable Care Act. We want to answer whatever questions that you have for our co-host, Dr. Keith Newby. 440-2665 or 1-800-940-2240.
One of the things I saw Mark had on this thing about how we can reinvent. Mark, I know I got off on a tangent about that bonus issue, but I wanted to kind of just finish up your question if you're still listening. It's really, to me, I think it's going to have to take, it's a lot of points that have to be addressed to reinvent our healthcare system. One is, we have to, people have to realize you can't make $1 gazillion off people. You can't. You shouldn't. It shouldn't do that. So it has to be from the healthcare system has to be reinvented in the delivery model, the intake model, meaning patients coming in, how much they're paying for their health insurance, them realizing, and the patients taking some responsibility for their own health care. Right now, a lot of responsibility falls on the hospitals and the doctors to provide the care, but it's no real responsibility on the patients doing what you ask them to do. If you say, listen, I need you to,
because you won't cut them off if they don't do what you tell them.
And the insurance company won't cut them off either, but they kind of hold us accountable to make sure they're doing right, and we should be held accountable to some degree, but they have to be held accountable too. If you give them all the tools they need, they choose not to do something, why should I pay the penalty because this person? And I've had patients say, I'm not doing that. I'm not cutting this out. I've been eating bacon and eggs and sausage every morning for the last 50 years, and I'm not changing anything. And they tell you that, and then they weigh 400 pounds, and then they say they want a wheelchair because they can't walk. Which it's not that we want to be unfeeling, but I'm like, dude, come on, help me some. And that's the issue. So you got the intake of the patients, you got the outlay of the plan for the patients. You got to get on these drug companies. They can't charge $1 billion for drugs. If they had to be realistic about how much these things cost.
Speaking of drugs, excuse me, without going into, because I don't remember the name of the drug, but there's a new commercial out about people who have type 2 diabetes,
Uh-huh.
and they equate it to heart problems.
Right.
And so they're basically trying to convince you to take this new medicine.
Right.
How is the consumer, the patient, supposed to weed through all of that to figure out if in fact that's the case? I mean, in other words, because I've seen this commercial, should I go run into my cardiologist and say, what's going on? Or is there something different?
Well, really, what I tell people is this. They should be able to bring it up to their physician and say, listen, I saw this. Is there any stock to that? Because, commercials is marketing. They're trying to market their drug. Some of it's legitimate stuff, and I've seen some good data on certain medications. Some things are not as clear-cut. But I think that's where we as physicians, we're supposed to be the patient advocates. If you come to us with an issue, our job is supposed to be to take care of you, to make sure that you are informed and that you understand the dynamics of your particular condition. Yes, it is true. We look at, if you're diabetic, we look at you as already having heart disease, period. And that's because there's data out there that says that. Second, people who are diabetic who have, the biggest risk for a heart attack is people who've had a previous heart attack. The risk of a diabetic having a first heart attack is the same as the risk of a heart attack victim having a second heart attack. We know that, and that's been proven years ago. So that's why we're so on top of diabetics about, making sure we're keeping their A1C levels down, and we're kind of staying on top of that because we know the relative risk of them developing vascular and heart disease is so high. Stroke risk, heart attack risk, all that stuff. So that's why. So there is some validity to it. Now, whether or not that particular medication is going to reduce the risk, we don't really know. A lot of times it's not even medication induced. You'd be surprised just with diet and exercise. True diet and exercise, a lot of people can reverse or at least put off the complications of diabetes, but they won't do it. It's hard to get people to understand that. And it's hard for them just to conceptualize what we're talking about because most people who have these illnesses don't feel bad.
They don't feel bad.
And it's hard to convince somebody who doesn't feel bad to change something.
That's why high blood pressure is
difference.
It's so hard to convince people that they need to take their medicine every single day because you don't feel bad when you have it.
And it's hard. And I understand that. The human side of me understands how people feel. So I don't pass judgment. I just try to educate. Because if we can educate them and get them to understand it, but get them to have some buy-in, you'd be surprised what we could do. We could reduce healthcare costs, but people just have to be. And the unfortunate reality is that small group of people that I was talking about earlier, they run up all the healthcare costs. And that spills over into the people who are healthy and why they have to pay more premiums because of this group of people. So really, if you're going to reinvent the system, that group of people that run up all the healthcare costs, resources had to be put for prevention of that group, to help them understand. And that means you may have to have a nurse calling them every day. What are you doing? What are you eating? I need you to come here. We got to see you a little bit more often. We got to be and patients oftentimes would appreciate that. But you got to put the resources in, and people have to be willing to put politics aside and say, okay, what is the problem we have to deal with? And let's fix the problem. Let's not play politics. That's why people like me, because I don't care if I make a Democrat mad, a Republican mad. I'm about that patient and how they are impacted, because if we can get past the rhetoric and we can start reducing those costs, heck, selfishly, that means my insurance premium is going to go down and yours is going to go down.
Exactly.
And everybody else is going to go down. So there is some selfishness behind it. But the unspoken reality is that we can do that. We can really get this population better, and we can be, as a country, we can start really reducing that deficit that everybody talks about. But people have to get past the nonsense to the realities
of what's going on. If you're just joining us, we've opened the phone lines to talk about health issues with my co-host for Another View, cardiologist Dr. Keith Newby. Call us with your questions, 440-2665 or 1-800-940-2240. Sue joins us from the Eastern Shore. Hi, Sue. You're on the air.
Hi. Thanks for taking my call.
Sure.
I wanted to follow up on what you were talking about earlier with the insurance CEOs making so much money and everything, because there's another part of it as well. I just had an operation recently, a disc fusion, and just got the total bill and everything. And Anthem wrote down about, I would say, almost 50% of my bill, which was great for me. I still have to pay much more than I should, but anyway. But the reality is that people who don't have insurance or don't have good policies don't get that write down. And they are paying twice as much as the rest of us for the same services because the hospitals and their billing structure, and this goes for not just the inpatient, but testing and everything else, the billing structure is so bizarre that the people who can least afford it are the ones who are paying the highest rate, and that's how people are still going bankrupt and still having to struggle between paying their hospital bills or getting food.
Okay, we will let Dr. Newby respond to that. Thanks for the call. So her point being that she has a good insurance policy. If you don't have an insurance policy that will pay as much, you wind up paying more out of pocket.
Yeah, well, there's, I guess the thing is it depends on the situation because unfortunately, the policy that's chosen, what I'm finding is issues is I'm seeing like insurance brokers would go to like elderly patients and say, okay, it's time for you to start picking your insurance. And what do you want? And they'll say, I want to pay that much money. So, which rightly people are going to say. So they say, okay, then this is your best policy right here. Not really explaining to those patients, though, that insurance, what they're really getting, what it's going to cover, what it won't. Right. And so, because they just, and the insurance broker say, well, they told me they didn't want to pay that much. I'm like, yeah, but you got to tell the person what they're getting, because if they have certain conditions that are going to, where they need that kind of coverage. I mean, they don't know what you're selling them. They just say, you ask them a question, what do you want? And naturally, everybody's going to say, I want to pay the least amount I can, but they have to understand what the drug coverage is like, what are the issues they need to run into. I said, you as a broker are supposed to help them make the best decision. I said, but, but to answer her question, I mean, the thing is with hospitals, it depends on the hospital system. There are some hospitals that really don't make that much money. I mean, they really don't. You have others that do, but a lot of them don't. It's hard to make money. It's harder to make money in this system than it was 20 years ago. So there may be, but I do agree with her, though, the billing processes are way out left field. I mean, it's hard to follow. And if you get somebody, it's like I had a patient of mine, it actually was a friend, as well. He showed me his bill, and because I had to do a heart catheterization on him, and one of the things that he got short of breath after the procedure, he has asthma, so I had to write for him to get an inhaler. So he showed me the bill. The inhaler, they had $800 for the inhaler.
Wow.
And I couldn't help but laugh. I said, $800? And I don't know where they got that number from or how they came up with that, but I thought that was crazy. And then the hospital is going to say, okay, they can't take that inhaler home with them. I said, but you charge them $800 for it. I mean, it's just insane. So it really, I agree with her that there are a lot of the system is really broken. Yeah. I mean, the system is broken, but it's going to take people who can put aside things and say, okay, look, what are the issues that are the problem? Let's take it from A, B, C, D, E, and let's fix each one.
Well, all of us, though, can contribute by doing the preventative things that we need to do in order to try to keep ourselves healthy. You know what? We got the line is full, so let's take some calls. Dr. Fred joins us from Virginia Beach. Hi, Dr. Fred.
You all doing a wonderful job. Keith, Dr. Newby, I agree with you 100%. You're explaining everything well. I, too, am a physician, and, we're in the trenches together. Yeah. And the big culprit, another culprit, other than insurance carriers, which are raising premiums and raising co-pays and paying less for this, that, and the other thing, you don't even know what you have, it's also the pharmaceuticals. And I think you all mentioned that.
Yes.
These pharmaceutical companies are raising their prices astronomically because I think they want to profit as much as they can before we come to the possibility of a single payer.
Yeah.
I am a proponent of the Affordable Care Act, and I know that it got vilified when they called it the Obama Care because it was against Obama, but I applaud President Obama for what he has done. I am upset over Donald Trump, who says, let it fail. I applaud Senator McCain for stepping up the way he has done because, he has the tool. And I don't think that's just it, but reality sinks in, and God works in mysterious ways. And we all need health care. But the cost of pharmaceuticals is ridiculous. Products that are barely like hydrocortisone cream over the counter that might cost $5 or $10 at the drugstore. If you get a prescription for it now, it might be $400. And it's no better than maybe a 1% hydrocortisone cream. But the insurance company, they send these rebate cards. There are lobbyists involved. There are a lot of wolves out here that are profiting. And I just want to say thank you for all that you're doing. But we have to reel in these pharmaceutical companies. I haven't heard them discussed at all in this whole debate about health care.
All right, we're going to talk about it now. Thanks so much, Dr. Fred. We appreciate it.
Yeah, I know Dr. Fred real well.
I think that's the Dr. Fred I know, too.
Yeah, we're all very good friends, but he's absolutely right. I mean, like I said, it's what I mentioned earlier, it's multifactorial. And he's right. Everybody wants to make $1, but no, they want to make more than $1.
I'm trying to remember the name of the CEO that got into, the young guy that got into all the trouble recently because he raised the price of
there was the epinephrine stuff.
He raised that, and people really came together and protested and were able to change that.
But see, that's the thing though. But you got to have people that unfortunately, so the system. I mean, the system is messed up on so many levels. You think about even in the political scheme. Okay, I'm a lobbyist group for whatever insurance company or pharmaceutical. Okay, I'm gonna come in here and I'm gonna give you $10 million for your campaign. Do you think that guy's gonna sit there and say, okay, I'm gonna fight you tooth and nail when I know you're helping me get reelected? You got to start. I mean, there's so many places it has to start. But until we get rid of that piece that allows people to start saying, okay, and really it's going to be the American people. Because the American people want casting the votes. I mean, the person can give you all the money you want, but the American people stand together and say, you know something, we're not tolerating this anymore. If you can't do the job, then we're going to put somebody else in there that will.
And, the thing that concerns me, though, is, and I'm in the communications business, but we have so much rhetoric from so many different sides, and that a lot of the American people just go, you know what, I'm going to go do my job and go take care of my family, and I really can't even deal with this. I mean, we've got to figure out a way to break through the clutter so that people truly understand the power that they have.
It's really going to be honest with you, people on the ground level. The one thing I applaud President Obama for, he is a big grassroots kind of guy, and he's a community activist. He was always a proponent of that in terms of getting the message, to whoever needs the message. So I think that's really what it will take, is going back to the basics, of that.
Let's talk to Bill in Suffolk. Hi, Bill. You're on the air.
Yes, hello. Thanks for taking my call. I
Sure.
appreciate it. And this is kind of a topic that's relatively new to me and my family. And my daughter was diagnosed with a autoimmune deficiency disease, and she requires monthly infusions or every 8 weeks. And we have to go to the Children's Hospital here in Hampton Roads to get that done. And the medication she's on is extremely expensive. And I do have insurance. I did start out on the Affordable Care Act. I did pay for a very, pretty costly plan at the beginning, but yet the deductible was still high because you can't put out as much money as you'd like to. That being said, so she's doing great, and we continue to go there. One of the challenges I came across was we were traveling, and instead of flying back to Virginia, we said we'd like to go get her treatment done at another children's hospital in another state. And when I compared the bills that I had, again, they were itemized. When I compared the bill to one state to the other, the one here in Hampton Roads was 3.5 times the amount that we were charged in another city. And the only difference was the drug that she is on was over 2 times. So it was roughly about 3 times the cost here in Hampton Roads. And when I confronted the hospital and asked the question, their comment to me was that we can charge more for drugs because we have more people on government programs here, so we're allowed a markup. So the challenge for me was, I fall in an income bracket where nothing can get written off. So all of these medical bills fall on us. And again, they say, great, we're not going to charge you interest on your medical bill, but I still own it. And this process will continue the rest of
for a long time.
My daughter's life.
Okay, Bill, thanks so much for sharing that. The question is, I guess hospitals have the ability to charge what they want. Does it matter whether they're public hospitals or private hospitals or just like in any other institution, public versus private? Is there a difference?
Well, I think that, most of them have contracts with insurance carriers. So, they can charge whatever they want, but the insurance usually says you can only charge,
up to a certain amount.
Exactly, a certain amount. But I don't know how that works in a hospital setting. But, again, we get back to that issue of, I understand what the hospitals are saying to some degree, but it shouldn't necessarily make you as a consumer have to pay the price because they're taking care of more people under one insurance plan versus the other. And that's what's essentially happening. And the consumer is the one that's paying the penalty in the end. I mean, the final analysis is if the cost is passing over to you as a consumer, you're like, man, I'm not trying to be the one that's being victimized here. And that's the downside to that issue.
Now, Lisa, what line do we want to go to? Let's go to Norman in Virginia Beach. Hi, Norman. You're on the air.
Hi. Thanks for allowing me to speak. I don't want to. I'm not going to hopefully upset the good doctor, but there are many challenges, and most developed countries who have universal health care have far better outcomes than we do. One of the challenges I notice is that they all have many more physicians per 100,000 of population than we do. Ours is about 250 per 100,000. Theirs are closer to 300 or more per 100,000. So that's certainly one challenge among many, and I wonder if the good doctor could give us some comment on that.
Okay, thank you, Norman, for your call. We appreciate it. So he's talking about the number of doctors per patient,
I guess he
per
said
population.
That there was
and he was saying that there
doctors,
were more. He's saying in America there are fewer doctors than there are in other countries.
Well, the thing is, I'm not sure in other countries how much it costs to become a doctor, but I know here, this is crazy. I graduated from medical school in 1990. I was telling my age a little bit, but I know at the end of that deal, I owed about $100,000,
wow,
coming out of, that's a lot of money, and unfortunately, so, when you talk about being able to, and you have to be able to have a job that's going to allow you to pay that back. And really, so that's when we get back to this multifactorial problem. I can't say that universal health care is better because I don't know. I've never lived in another country to really say. But I can tell you that I think the dynamics, you have to look at more than just the outcomes, meaning, okay, what's the population like in another country? Are they overweight? Are they, what their diets are like? Because if you have a country where, say, 90% of people are thin and healthy and, the outcomes are going to be better because, generally speaking, they take better care of themselves, and their ability to have certain resources are maybe more plentiful. I don't know. But, for me, I have to look at it to say, is it that the universal system is better, or is it that it's just different based on what we have here in the country? One of the things to me, I think, I'm not a fan of a single payer system. I am a fan of that being an option for people that want to do it. You almost want to say, okay, let's take that group of people that creates all the issues and let's put them in a separate category where they have access to the resources and things, and that is the group that is focused on, because if you can get that group healthier, everything else takes care of itself. Your premium's going to go down, mine's, because a healthy group of people, we're not paying for everybody else. And I'm not saying that is the answer, but it has to be something along the line of identifying where the costs are coming into, and then trying to help those individuals reduce those costs.
Let's talk to Carter, because I think he wants to talk about this single payer framework also. Hi, Carter, you're in the air.
Thank you. Yes, I did want to talk about single payer. I heard Dr. Fred talk about it, and I think it's the way to go. I used to volunteer when I lived in D.C. for the Clinton healthcare reform actions back in the day, and I really feel pretty strongly, to ask Dr. Newby something in his field, how come it costs 10 times more to get a stent in America than it does in France?
Well, that's probably going to have to be the hospital answering that question, because I'm going to tell you, they don't, because I'll be honest with you, what they pay us to do it, we get a fraction. Because it used to be, and I just be upfront with people, back when I was in medical school, if you were a cardiologist and you did a stent on somebody, you got probably about $2,000 to do a stent, individual to that individual doctor. But now if you get $800, that's a lot. It's changed tremendously. Now the hospital costs are, that's where I think a lot of the bulk of the cost is. It's not us. Mm-hmm. It's the hospital cost, because I think they're about $30,000.
I want to go back to the question that a previous caller brought up about the number of doctors. Uh-huh. Is there a push to get more people into medical school now? And also, if there is the whole idea of specialty versus general practitioner, does that play a role in determining if somebody wants to become a doctor and what kind?
Well, I tell you what the bottom line is to me is cost. You have some. And I'll be honest with you. I don't advocate. None of my kids want to go into medicine.
No, none of your children want to go into medicine.
My youngest is 12. I don't know what she's going to do. We'll see in the end. But none of my other two, neither one of them wanted to do it because they saw how I worked. You know what I mean? And they're like, forget that, which I can't say. But I'm different. I'm a workaholic, and I'm very dedicated to my field and my task and what I do. And I do a lot of work I don't get compensated for. But I do it because it's the right thing to do. That's why I applauded McCain so much, because he's like, forget the radical, I'm going to do the right thing. When you're trying to apply to medical school, you want to go to medical school, first thing is you got to be that's and I guess maybe I take it personal. That's not a field to me I'm going to tell somebody to go into because it's just a fad. I take my field very personal, and I take a lot of pride in it. I want you to come in this field because you want to help people, firstly. Secondly is the cost, which is the biggest thing, and why people don't do it as much. Partly is because of the lifestyle, but partly is, and maybe a large part is the cost. If they could find a way, because if you come out, say if you're a primary care doctor and you only make a certain amount of money, and primary care docs are typically going to be the least paid in terms of reimbursement out of the hierarchy. Uh-huh. So if you're getting paid only a certain amount and you have a lot of bills to pay back because, to go to medical school, you have, $100,000 of loans, that's hard. Yeah. So, they have to find a way to, if they really want to do that, and I've heard people talk about increasing the number of docs. I'm like, but what are you doing to help? You have to have it where they don't have to pay so much back to get people to go into. If you're looking for more primary care docs, then you have to make it,
because then even once you get out, if you're going to set up your own practice, then you've got the overhead, you've got all those costs involved, or you have to join somebody else's practice,
or you have to be a part
of a hospital
system.
Okay, we've only got about 5 minutes left. Can you believe that?
Yeah, we're rolling through this one.
Let's talk to John in Virginia Beach. Hi, John. You're in the air.
I want to address something a woman said earlier about insurance payment write-downs versus cash payments, because of the way that they structure the cost of medicines and procedures and even lab work. It's really imperceivable as to what it really costs. For example, to get the venipuncture for a simple test used to be one of the most inexpensive things that were charged when you go to a lab. Now it is up to $60, $80. And so in the combination of all of the tests that your doctor may order, then what's called the transaction network write-off, because my lab company is in the network, they'll mark off 85% of it. The insurance company will agree to pay this, and I might have a $20 copay. Whereas somebody who is paying cash has no no chance to be able to negotiate and say, I want to say right off is that insurance company is doing for Sally over here who has insurance.
Okay.
And so the person who is cash, there's no real reason or rhyme or reason what real things
what the real cost is. John, I hate to cut you off. We're almost out of time, and I want Keith to have time to respond to you. Thank you so much for the call.
Well, he's telling the truth. It's hard to really get in there and figure out, because just like the person mentioned earlier, if they go somewhere else and they say, okay, we do it, we charge X amount because we have to take care of all these other people with this insurance or that insurance. So, I mean, so he's right. You really don't know what something really costs. But when you look at it from even a legal standpoint, a lot of times people are ordering stuff because they worry about getting sued. I mean, which shouldn't be the case, because to me, if Joe Blow sat at home for 8 weeks with an affected leg ulcer, and he decides when his leg is about to fall off to come in, and then he has to have the leg amputated, and then some family member pops up that you ain't seen before, and they ain't showed up in 20 years, and then start raising a bunch of sand, because they say, why you cut off his leg, and then blah, 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 and here comes the lawsuit. But the person sat at home for 8 weeks prior to coming in. I mean, then here's people starting to say, okay, well, I'm not going to deal with that. So anybody comes in, I'm going to order XXXXX.
They have the test to cover them.
And so here we go, healthcare costs going up because of that issue. So really, it's so many levels of things that have to be addressed.
And the insurance that you as a doctor have to have also.
Yeah. That's what I'm saying, malpractice, because then the malpractice goes up because of the lawsuits. Because say like somebody does a lawsuit, and say it was really frivolous, there was still legal fees involved. The malpractice insurance still has to pay those legal fees because you have health insurance. The lawyers are getting X amount of money to do a case that got thrown out,
right?
But they still have to get paid. So then here's more costs going up because the insurance company is going to pass that cost on to us because they have to cover themselves when these types of things pop up. So it's a
big vicious cycle.
It's like big vicious cycle.
Well, you know what, Dr. Newby?
The
great thing is that we were able to talk about it today. Yep. And hopefully we'll be able to have Dr. Terry Ann Samuels on with us at another time once she gets well. And although I think that our audio engineer, Victor, was happy that we didn't have that conversation because he was...
Well, you know something, though. But
he was a little nervous.
But you know something, though. But I think I was glad we were able to do this today, though, because this is the kind of discussion I think that's important to have, because I'm hoping that people will hear this and see the multiple levels of problems that are there and become involved, reach out to their respective congressmen or whatever and start saying, listen, we're running into an issue, because until we do that, it's never going to change.
It's never going to change. Thanks so much, Keith, for being here. We'll see you soon, and we'll be right back.
Hi, I'm Claude McKnight of the group Take 6, and you're listening to Another View.
There's a new sun rising. I can see a new horizon. You will keep me realizing you're the biggest part of me.
I like that song. That is just so pretty. Those of you who called in and we were not able to get to your questions, if you want to go to our Facebook page and send us your question, we'll try to get some answers for you. Translating what you love into a business opportunity, just one of the important lessons a group of young women are learning this summer, thanks to a program called Envision, Lead, Grow. The movement is the brainchild of Norfolk businesswoman Angela Reddix. As our Lisa Godley found out, it is transforming lives by giving young entrepreneurs the skills they need to achieve their dreams.
I am the CEO of Gifts. I am the CEO of All Smiles Babysitting.
They're still in middle school, and yet they're well on their way to making big things happen in the world of business. They're participants in a program called Envision, Lead, Grow, or ELG. Its goal, to break the cycle of poverty by sharing the power of entrepreneurship with girls and young women. ELG's founder is business owner Angela Reddix, who happily shares ELG's mission.
Entrepreneurship often is what I call a bridge over troubled waters. In areas where you may not have access to many things, you can gain access if we provide a forum for young people to practice entrepreneurship before the stakes are so high and it impacts their livelihood.
ELG began last summer, hosting a camp at Kempsville High School. Megan Timlin is the coordinator of the Entrepreneurship and Business Academy at Kempsville and says she knew from the very start that ELG would be a wonderful opportunity for her students, and it did not disappoint.
It was just great to watch the experience of Envision Lead Grow here at Kempsville and the traits that are provided, the seeds of success that Angela teaches them throughout the week. We just really saw our girls grow and develop as leaders just within that short week of a period of camp that they had. And so it was a really neat experience for them to come in kind of shy and timid at the beginning and leave pitching their own business ideas. It was really, really rewarding for us to have had that here this last summer. And, we wouldn't hesitate to do it again if given the opportunity. It was a great experience for students.
This summer, Reddix, flanked by a handful of young entrepreneurs, took Envision Lead Grow on the road, hosting a 7-city bus tour packed full of entrepreneurship immersion programs. This time focusing on middle school students. Their first stop was Memphis, Tennessee.
I want young ladies to understand that anything big started with just a seed. And those seeds are the seeds that we talk about, the 8 seeds of success.
You are going to be able to identify what you love and how to translate that into an opportunity.
ELG has taught me to realize what makes my heart sing, and that is photography.
Program participants like 12-year-old Abby Solo of Baltimore shared a little of what she's gleaned from ELG.
What I really liked about this week is that it gave me a new perspective of business and made me learn about an elevator pitch. I didn't know about that before because they don't teach it in school.
As the tour moves from city to city, the young participants learn everything from a proper handshake to speaking about their business as if it already exists, and then, of course, what it takes to make that dream a reality.
You have to start saying to yourself, I am a business owner. I am successful.
ELG has taught me to be confident and think out of the box.
It's a concept Morgan Hicks, a rising 6th grader in Philadelphia, has grabbed onto and isn't about to let go of. Morgan is turning her love of fashion into a booming business.
I wanted to bring in one of my products, so this is the bag I made out of an old denim jean skirt. So I just sewed the bottom together and turned it inside out. And then I put a scarf around it, so now it's adjustable so I can open and close it.
She's already gotten offers to sell her products in several stores and boutiques. Just one example of why, when their week of training is complete, the participants are eager to say,
"Thank you, ELG."
For Another View, I'm Lisa Godley.
Young entrepreneurs making a difference. We love it. Thank you so much for taking an hour of your day to spend with us here at Another View. We'd really appreciate it if you tell a friend about the show. You can find our podcast on iTunes, on our website, anotherviewradio.org, or wherever you go for your podcast listening pleasure. Next time on Another View, the 50th anniversary of the first African-American students in residence at the College of William and Mary. We'll talk with them about their experience and how it has helped shape their adult lives. Our theme music was composed and performed by Jay Sennett. Lisa Godley is our show producer. Victor Bowen is our audio engineer, and Trey Watson answered our phones. A very special thank you again to my co-host, Dr. Keith Newby, who was able to come in here and we carried it off anyway. We appreciate that. I'm Barbara Hamm Lee. Thank you so very much for listening to Another View.